Most men have asked themselves this question at least once, but almost none of them say it out loud. What really happens if you ejaculate every single day? Does it protect your prostate? Does it improve your sleep? Does it drain your energy? Can it weaken your desire over time? And after 50 or 60, does your body respond differently than it did when you were younger? Gentlemen, this is one of those topics surrounded by myths, guilt, jokes, and silence. Some men believe daily ejaculation keeps the body healthy. Some believe it makes a man weaker. Some feel relaxed afterward. Others feel tired, foggy, or even emotionally empty. So today, we are going to separate fear from biology. I'm Melissa Carter, a medical researcher focused on men's health, hormones, prostate wellness, aging, and intimate function. And in this video, I'm going to explain what daily ejaculation may do to your body, the good, the bad, and the warning signs you should never ignore. Because the truth is not every day is good or every day is bad. The truth is much more personal. It depends on your body, your age, your hormones, your prostate, your stress level, your relationship, your fertility goals, and most importantly, whether you are choosing the habit or the habit is controlling you. Stay with me, because near the end, I'll give you a simple self-check that can tell you whether your current frequency is helping your health or quietly hurting your energy, confidence, and desire. Let's begin with the first important truth. Daily ejaculation does not automatically damage the male body. For many healthy men, it can be completely normal. The male reproductive system is designed to produce, release, and renew. Ejaculation is a natural function involving the brain, nerves, prostate, seminal vesicles, pelvic muscles, hormones, and blood flow. But natural does not always mean unlimited. Food is natural, sleep is natural, exercise is natural, but too much, too little, or the wrong pattern can still create problems. The same is true here. So instead of asking, is daily ejaculation right or wrong? Ask this: how do I feel afterward? That question tells you more than any internet myth ever will. Now let's look at what may happen when daily ejaculation is working in your favor. The first possible benefit is stress relief. After ejaculation, the brain releases chemicals connected to pleasure, relaxation, bonding, and emotional balance. These can include dopamine, endorphins, oxytocin, serotonin, and prolactin. In simple terms, the body shifts out of tension. Your muscles may relax, your thoughts may slow down, your mood may soften. That heavy mental pressure may temporarily lift. This is why some men feel calmer afterward. For men under work pressure, family stress, loneliness, or anxiety, ejaculation can feel like a biological reset. But here is the part most men miss. A reset is not the same as a solution. If you use ejaculation as one healthy outlet among many, that may be fine. But if it becomes your only way to deal with stress, loneliness, anger, rejection, or boredom, then it may be covering a deeper problem. That is where a helpful habit can slowly become an emotional escape. The second possible benefit is better sleep. Many men feel sleepy after sex or masturbation. This is not weakness. This is biology. After orgasm, prolactin rises, the nervous system relaxes, and the body often shifts toward recovery mode. For some men, this can help them fall asleep faster. And sleep is not a small detail. Sleep affects testosterone, appetite, blood sugar, blood pressure, mood, memory, erection quality, and daily energy. So if ejaculation helps you sleep and you wake up feeling restored, that may be a positive sign. But if you cannot fall asleep without it, or if it becomes a nightly compulsion, then the real issue may not be sexual at all. It may be anxiety, insomnia, stress, or an overactive mind. And those deserve attention too. The third possible benefit is prostate activity. The prostate is involved in producing part of the fluid released during ejaculation. When ejaculation happens, the prostate contracts and releases fluid. Some research has found an association between more frequent ejaculation and a lower risk of prostate cancer in some men. One possible theory is that ejaculation may help clear fluid and cellular material from the prostate. But gentlemen, listen carefully. This does not mean ejaculation prevents prostate cancer. It does not replace PSA testing. It does not replace a doctor. It does not erase family history. It does not protect you from all prostate problems. If you are over 50, especially if you have urinary symptoms, nighttime urination, weak urine flow, pelvic discomfort, or a family history of prostate cancer, you still need medical evaluation. Daily ejaculation may be part of a healthy male routine, but it is not a magic shield. The fourth possible benefit is sexual confidence. Regular sexual activity can help some men stay connected to their body. Arousal involves blood flow, nerves, hormones, and pelvic muscle coordination. When those systems are active in a healthy way, some men feel more confident, more relaxed, and less anxious about performance. This can matter after 50, when many men begin watching every erection like it is a medical test. But confidence should come from awareness, not pressure. If daily ejaculation makes you feel comfortable in your body, connected to your partner, and relaxed about your sexuality, that may be positive. But if you are doing it to prove you are still young, still powerful, still a man, then the habit may be driven by fear. And fear is never a good foundation for sexual health. The fifth possible benefit is emotional connection. When ejaculation happens during loving intimacy, the body may release bonding chemicals that support closeness, warmth, and trust. This is one reason intimacy can feel emotionally meaningful, not just physically pleasurable. But there is an important difference between release and connection. A man can ejaculate and still feel lonely. A couple can be physically close and emotionally distant. A habit can involve the body but leave the heart untouched. So if you have a partner, do not measure intimacy only by frequency. Measure it by closeness. Are you both present? Are you both comfortable? Are you both respected? Does intimacy bring you closer, or does it feel routine and disconnected? That matters more than the number. Now let's turn to the other side. Because daily ejaculation can become a problem for some men. The first risk is compulsion. This is the most important question in the entire video. Are you choosing it, or is it choosing you? If you decide to ejaculate daily because it feels good, supports your sleep, and does not harm your life, that may be fine. But if you feel controlled by the urge, if you hide it, if it interrupts your work, if it affects your relationship, if you feel anxious until you do it, or if you feel guilty afterward, that is different. That is no longer just a habit. That may be a compulsive pattern. And compulsive patterns can affect focus, motivation, self-respect, and emotional stability. The problem is not the male body. The problem is losing control over a behavior that was supposed to serve you. The second risk is reduced sensitivity. Daily ejaculation, especially when it is rushed, repetitive, or heavily connected to pornography, can dull sensitivity for some men. The brain adapts to repeated high stimulation. Over time, normal intimacy may feel less exciting. A man may need more intense stimulation. Desire for a real partner may decrease. Erections may become less responsive. This does not happen to every man, but if it happens to you, do not ignore it. Your body may be asking for a reset. Reducing pornography, slowing down, taking short breaks, and focusing on real connection can help restore sensitivity. The third risk is fatigue. Some men feel calm after ejaculation. Others feel drained. If daily ejaculation leaves you tired, foggy, unmotivated, emotionally flat, or less focused, pay attention. This does not mean something is wrong with you. It means your body may not respond well to that frequency. After 50 and 60, recovery can change. Hormones change. Sleep quality changes. Stress tolerance changes. Medications, blood pressure, diabetes, weight, and testosterone can all affect how you feel afterward. So if your energy drops, do not argue with your body. Observe it. Try reducing frequency for 1 or 2 weeks and compare your energy, mood, desire, and focus. The fourth risk is using ejaculation as emotional anesthesia. Many men were taught to be strong, but not emotionally honest. So when they feel lonely, rejected, stressed, bored, angry, or sad, they search for a quick release. And yes, ejaculation may help for a few minutes, but if you keep using it to numb emotions, those emotions do not disappear. They wait. And over time, you may begin feeling disconnected from yourself, your partner, and your real needs. A strong man does not only release tension, he learns what created the tension in the first place. The fifth risk is fertility. If you are not trying to have children, this may not matter. But if you are trying to conceive, daily ejaculation may reduce sperm concentration in some men. Sperm need time to replenish. For many couples trying to conceive, timing matters more than constant frequency. If fertility is important to you, do not guess. A semen analysis can give real answers about sperm count, movement, shape, and volume. This is especially important if you and your partner have been trying for several months without success. Now, here is the self-check I promised you. For the next 7 days, pay attention to 5 things after ejaculation: your energy, your mood, your desire, your focus, your confidence. If you feel calm, clear, connected, and energized, your current rhythm may be working for you. But if you feel tired, guilty, distracted, numb, less interested in your partner, or unable to control the urge, your body may be telling you to slow down. You can also try a simple experiment. Spend 1 week with your normal frequency, then spend 1 week reducing it. Compare your sleep, mood, erections, motivation, and desire. Do not judge yourself. Just collect information. Your body is giving you data. Now, there are warning signs that should never be ignored. Speak with a qualified healthcare professional if you notice pain during ejaculation, blood in semen or urine, burning urination, sudden erection problems, testicular pain, pelvic pain, major change in ejaculation volume, or urinary problems such as weak flow or frequent nighttime urination. These symptoms do not always mean something dangerous, but they deserve evaluation, especially after 50. So let's bring this together. Ejaculating every day can be healthy for some men. It may support relaxation, sleep, mood, prostate activity, sexual confidence, and emotional bonding. But it can also become compulsive, reduce sensitivity, drain energy, hide emotional stress, or interfere with fertility goals. The answer is not shame. The answer is awareness. Your body is not something to fear. It is something to understand. So stop asking, what is the perfect number? Start asking, is this habit helping me become healthier, calmer, more connected, and more in control? If the answer is yes, you may be in a healthy rhythm. If the answer is no, it may be time to adjust. This is Melissa Carter. If this video helped you see your body more clearly, subscribe for more honest men's health conversations. And remember, your vitality is not measured by how often you release. It is measured by your energy, your confidence, your health, your self-control, and the quality of the life you are building.